Recent protests related to racial inequity and social injustice, juxtaposed with the pandemic and its disparate impact on minority communities, has emphasized the need for hospitals to examine their commitment to diversity and inclusion to better serve patient populations. According to HBR, evidence confirms that having women in upper management and on corporate boards is associated with improved financial performance and enhanced accountability. Becker's Hospital Review reports that diversity leads to more successful decision-making, contributes to meeting strategic goals, and allows for more equity of care. JAMA reported data that compared the 2010 U.S. Census against medical school graduates, GME training pool, and practicing physicians. During each upward step, there was a disproportionate drop-off of women and underrepresented minorities. These leaky pipelines demand explanations. The Cleveland Clinic boasts 66,000 caregivers worldwide. The CEO states that corporate culture does not, or at least should not, happen by accident. Culture is deliberate. We define it, we live it, and we are equally responsible for it. So how do we change the narrative in modern healthcare? Are there untapped solutions? The National Academies of Science, Engineering, Medicine states that gender harassment is the most common form of sexual harassment, and it undermines research integrity, reduces talent pool, and harms targets and bystanders. It takes place in environments that are male-dominated in leadership and numbers, and where reporting is risky or offers the offender escape sanctions. That is why diversified leadership and male allyship are essential. Organizational climate is the greatest predictor. Leadership can reshape the culture and effectively alter these environments. Some of the most powerful change come when leadership is inclusive and diversified. Dr. Carrie Wolanetz states that sexual harassment is about power, and the goal of the perpetrator is to objectify, exclude, demoralize, dismiss, and coerce the victim to exert power over her. This is keeping women from achieving their rightful place in science. What can globalized business leaders teach the healthcare industry? The U.S. can borrow ideas from UK on how to effectively incentivize these changes. The UK's Athena Swan Charter gives awards to institutions that meet their diversity, equity, and inclusion requirements. There has been a positive impact on gender issues in their universities, departments, and research institutions. The Bloomberg GEI score tracks the performance of public companies committed to disclosing their efforts to support gender equity through public development, representation, and transparency. The GEI is based on voluntary disclosure and diversified metrics, and companies are rated on how they achieve equal representation and parity. 380 companies comprise these databases, and scoring has moved them toward increasing diversity and inclusion. Grassroots movements are giving support, a platform, and voice to women to drive awareness and propagate change. If we unite and fight for the things that we care about, healthcare can be reshaped for future generations.